Good evening and welcome. My name is Mindy Lomasang. In this presentation, I will be discussing and critiquing the article Communication Competence Approach to Healthcare Worker Conflict, Job Stress, Job Burnout, and Job Satisfaction. The article is written by Kevin B. Wright, and I accessed the article from the Journal of Healthcare Quality. As healthcare professionals, we appreciate the fact that conflict among healthcare workers is inevitable in our existing healthcare organizations due to a multitude of factors: diversity in the workplace, status differences, hierarchical structure, patient workloads, and the demanding decisions that are required of healthcare providers. Unfortunately, this conflict has important organizational impact on outcome variables such as job satisfaction, stress, and job burnout, which affects the quality of healthcare delivery. The article discusses the role of communication competence in predicting conflict-style job satisfaction, job stress, and job burnout. As discussed in Communication Skills for the Healthcare Professional, conflict is a growing concern in healthcare organizations because of its negative impact on all involved and the consequences of low productivity, poor patient care, and staff dissatisfaction and turnover. The author utilized previous theory and research dealing with the interrelationships among organizational conflict, communication competence, job satisfaction, job stress, and job burnout to examine the role of communication competence in terms of prediction conflict style, job satisfaction, job stress, and job burnout among healthcare workers. I found it interesting when the author discussed that perceptions of effective conflict styles are dependent on culture. In the United States, our culture views integrating and compromising conflict styles as a more competent form, whereas dominating, obliging, and avoiding conflict styles are typically perceived as less competent. The researchers proposed 3 hypotheses and research questions. Hypothesis 1: higher communication competence will be predictive of integrating and compromising conflict styles, although lower communication competence will be predictive of dominating, obliging, and avoiding conflict styles among healthcare workers. Hypothesis 2: work-related conflict styles will be predictive of perceived job stress among healthcare workers. The third hypothesis was work-related conflict styles will be predictive of job satisfaction and job burnout among healthcare workers. The research method utilized 221 healthcare workers from 3 large VA hospitals here in the United States. The credentialing of the participants broke down to be the majority of physician assistants, followed by nurses, technicians, and then support staff. Communication competence was measured using Wyman's 36-item communication competence scale. Workplace conflict style was measured using RAM's Organizational Conflict Inventory 2. Perceived life stress was assessed by using Global Measure of Perceived Stress Scale. The researchers assessed job satisfaction using Spector's Job Satisfaction Survey. The researchers then used 2 dimensions of burnout inventory, emotional exhaustion, and depersonalization to assess job burnout among the healthcare workers. The results of the study revealed that integrating conflict style scores were predictive of reduced stress, higher job satisfaction, and reduced burnout, whereas avoiding conflict style scores were associated with increased stress and increased job burnout. Overall, I felt this article was well thought out. The study showed implications for the relationship between communication competence and work-related conflict styles among healthcare workers. Positive attributes of the article: I enjoy the thorough review of the literature that was presented prior to the study. Also, it provided a different approach to assessing job stress, job burnout, and job satisfaction than one usually encounters. The limitations I cited were the overall sample size was really not diverse, and it was fairly small. It was a small population of healthcare workers from within the same type hospital system, and the participants were predominantly white. Also, they did not discuss other factors of job stressors: patient acuity, provider-to-patient ratio, which typically play a role in outcome variables. Due to these factors, I think the ability to generalize to the larger population might not be applicable. In conclusion, this article provided a unique perspective from a communication competence, differentiating the conflict management skills that individuals possess as it relates to vital organizational outcomes such as job satisfaction, stress, and job burnout. Though conflict among healthcare workers is inevitable, it remains a growing concern for healthcare organizations because of its impact on a variety of organizational factors. Please take the time to contemplate how the information in this article might be applicable to you and your organization. Some discussion questions to help guide you in your thoughts. As healthcare managers, would you be willing to create interventions designed to increase communication competencies among your employees? How would you envision a program that would create interventions designed to increase communication competencies and work-related conflict styles among your employees? Given that integrating and compromising conflict styles are predictive of reduced stress, higher job satisfaction, and reduced burnout, are you willing to allocate more resources to provide continuing education for your employees in this domain? Would you utilize this method of communication competence and work-related conflict styles in identifying ideal candidates during the interview process? Are communication competencies and work-related conflict styles incorporated in your organization's exit interview process with employees? If not, do you think this would be helpful? Thank you for taking the time to view this presentation, and I look forward to the ensuing discussion with you. Have a good evening.